Alright, let's dive into something that's been making waves recently, Yvette Cooper's bold stance on maternity care, and the idea of the ideal birth. Now, before we get into the nitty-gritty, let me just say this, personally, I think this conversation is long overdue. What makes this really interesting is how Cooper is flipping the script on a topic that's often shrouded in expectations and pressure. So, let's break it down. First off, Cooper's promise to reform maternity standards comes after some pretty damning scandals. And here's where it gets fascinating. She's not just talking about fixing the system, she's calling out the culture around childbirth itself. In my opinion, this is huge. What many people don't realize is that the pressure to have a perfect birth experience isn't just a personal struggle, it's systemic. Cooper's point about women feeling forced into a certain kind of birth. That's not just a minor issue, it's a reflection of deeper problems in healthcare. Now, let's talk about the ideal birth myth. Personally, I think this idea is one of the most toxic narratives out there. What this really suggests is that there's a one-size-fits-all approach to childbirth, which is just not true. Every birth is different, every body is different, and every family's needs are different. Cooper's emphasis on informed choice and evidence-based care. That's not just a policy change, it's a mindset shift. If you take a step back and think about it, this is about giving women agency over their own bodies and experiences. One thing that immediately stands out is her plan to reintroduce binding national maternity standards. This isn't just bureaucratic jargon, it's about ending the postcode lottery for care. What this means is that where you live shouldn't determine the quality of care you receive. And let's not forget the racial inequalities she's addressing. Black and Asian women, in particular, have faced worse outcomes. This isn't just a healthcare issue, it's a social justice issue. From my perspective, this is where Cooper's reforms could make the most impact. Now, here's a detail I find fascinating: Cooper's own experience as the first minister to take maternity leave. She's not just speaking from a policy standpoint, she's speaking from personal experience. This raises a deeper question. How much of this reform is driven by her own journey? I think it adds a layer of authenticity to her crusade. She's not just a politician, she's a woman who's been through it. But let's not sugarcoat it, this isn't going to be easy. Cooper's talking about tackling toxic institutional cultures, clinical errors, and understaffing. These are massive challenges. What makes this really interesting, though, is her determination to listen to mothers. She's not just focusing on medical outcomes, she's prioritizing patient experience. In my opinion, this is where the real change happens, when the system starts treating women like humans, not just patients. Now, let's talk about the backlash. Valerie Amos's review, for example, faced criticism for not explicitly warning about normal birth ideology. This is where things get tricky. Personally, I think the debate around natural versus medicalized births is often oversimplified. What many people don't realize is that it's not about choosing sides, it's about having options. Cooper's push for a maternity commissioner. It's a step toward ensuring those options exist. Finally, let's zoom out for a second. Cooper's reforms aren't just about maternity care, they're about reshaping the NHS's priorities. She's talking about putting the cradle back at the heart of the system. What this really suggests is that we've lost sight of what healthcare should be about: caring for people, not just treating conditions. From my perspective, this is the bigger picture here. So, where does this leave us? Personally, I think Cooper's approach is a breath of fresh air. It's not just about fixing what's broken, it's about reimagining what's possible. But here's the question I'll leave you with: will these reforms be enough to change a culture that's been entrenched for decades? Let me know what you think in the comments. Because, at the end of the day, this isn't just about policy, it's about people.